feel tired and sluggish all the time? And are you fighting depression? Do you have trouble controlling your weight even though you eat right and exercise? It may be that you have the condition we'll examine today on Weekend Connection.
We've seen it in every single population and in both genders. So it's one of those diseases that doesn't seem to greatly discriminate whether you live healthy or not, whether you have a family history or not.
I'm Vic Gregory, and let's get connected. You may be surprised to know that an estimated 20 million Americans have some sort of thyroid disorder. Furthermore, according to the American Thyroid Association, 60% of those with a thyroid disorder are not aware of their condition. Now, that doesn't mean they have no physical problems. They're just not aware of the fact that those issues may be connected to problems with their thyroid. Today, on Weekend Connection, we'll take a look at some of the common thyroid ailments, how they affect those that have them, and what can be done to treat the conditions. Joining me today is Dr. David Kim. He is the founder and chief executive officer of Beacon Christian Community Health Center in Staten Island, New York. Beacon Christian Community Health Center is New York State's first faith-based, federal and state certified nonprofit health center. Dr. Kim graduated from the State University of New York Downstate College of Medicine and subsequently completed a combined dual residency in internal medicine and pediatrics at Staten Island University Hospital, Kings County Hospital, and Downstate Medical Center. He also holds an MBA from George Washington University School of Business. Most importantly, he is a brother in Christ. And Dr. Kim, we welcome you to our broadcast today.
Thank you for having me, sir. It's an honor.
Well, we're glad to have you on the broadcast. And let's begin by discussing the thyroid. What is it and what does it do?
So the thyroid gland is not commonly known to a lot of people. It's actually a very small gland located in the front of the neck under the vocal cords. It's controlled by the brain, and it secretes two forms of thyroid hormone, thyroxine, also known as T4, and triiodothyronine, which is a long way of saying T3. You might hear about T4 and T3 when you go to your doctor. Now, together, both T4 and T3 play a critical role in controlling pretty much every single cell in your body, its metabolism, its function, and so they control key body functions like breathing, heart rate, the nervous system, body weight, body temperature, and so many more things. In women specifically, thyroid hormones help to control menstrual cycles. And so while it's small and unknown to many, God has really made this gland to be an important and critical part of our bodies, and that makes them tick.
Well, what is the difference between the thyroid disorder hypothyroidism and the thyroid disorder hyperthyroidism?
Well, simply put, hypothyroidism refers to an underactive thyroid gland. The thyroid gland is not making enough thyroid hormone to do its normal functions. And there's a number of reasons for this. They can be inflammatory reasons, such as Hashimoto's thyroiditis, which is the most common cause of hypothyroidism, or more rarely, disorders of the part of the brain which controls the thyroid gland. And even certain medications, most notably anti-seizure medications and classically lithium, can also cause hypothyroidism just by their side effects. Now, hyperthyroidism, on the other hand, refers to an overactivity of the thyroid gland. So it's making too much. And conditions like Graves' disease and, again, more rare brain conditions and, again, certain medications such as interferon or certain heart medications can cause hyperthyroidism. And I should note that there are some medications that can actually cause both hypo and hyperthyroidism. So it's another reason to be checking with your doctor or healthcare professional if you think your body isn't doing what it's supposed to be doing.
Well, what are some of the symptoms of hypothyroidism and hyperthyroidism?
Well, let's start with hypothyroidism because that's a little bit more complex. The problem with hypothyroidism is that usually the symptoms are subtle, and so they can manifest over a number of years and be mistaken for seemingly normal processes. So you might think as you're getting older, oh, I'm probably just getting a little out of shape. Oh, I'm just getting a little more tired than usual. I must just be slowing down. It's a great imitator of a lot of normal things. So when you're a physician looking for this diagnosis, or if you're a person that's beginning to wonder what's wrong with yourself, you're looking for progressively worsening symptoms like fatigue and sluggishness, general aches and pains, memory loss, weight gain, depression, other types of vague symptoms like that. Particularly for women, they can start to have abnormal menses. And so that's why these symptoms can easily be mistaken for other more normal things. Hyperthyroidism symptoms tend to be more dramatic. Think hyper, right, for hyperthyroidism. People get progressively anxious. They can't sleep. They feel jittery. They can't concentrate. They may have weight loss. They may start to feel palpitations. In more severe cases, you have that classic picture you might have seen in books of the eyes bulging out, which is a sign of significant Graves' disease, which is one of the forms of hyperthyroidism. Or in certain rare conditions, your heart rate can rise so high that along with sweats and dehydration, it could be a life-threatening thyroid crisis, so to speak, or a thyroid storm. You might hear that term as well. And there's a number of other symptoms of both conditions that can manifest as well, and that's related to the fact that the thyroid regulates a lot of processes throughout your entire body.
You touched on it, and let's delve into it a little more specifically. How serious are thyroid disorders? Can they shorten your life?
They can, and particularly if unchecked, undiagnosed, and untreated, either severe hypothyroidism or hyperthyroidism can shorten your life. And it's usually through the development of heart disease, amongst other potential complications. But this is the tricky part. Even milder forms of both will potentially impact the efficiency of the body's function and possibly put a person at risk of developing these conditions as well. So it's really important to make sure that you're regularly seeing your healthcare provider and also paying attention to things you see in yourself that may start to not fully make sense in you.
I understand, Dr. Kim, that there is a connection between some forms of thyroid disorders and intellectual development disorder in newborn babies. Tell us about that, if you would, please.
Sure. So congenital hypothyroidism, which is pretty much what people are referring to when it comes to infant thyroid disorders, occurs when, for some reason, infants are born with a thyroid that is not functioning normally for various reasons, or in some very rare cases, are born without a thyroid gland altogether. Now, the reason why many states mandate newborn screening for hypothyroidism is because symptoms may not always be present initially at birth. However, as time goes by, infants can develop symptoms such as jaundice, poor muscle tone, excessive sleepiness, and difficulty breathing. And if unchecked and untreated, these children can develop severe physical and mental deficits. This is why newborn screening programs, along with provider vigilance, can intercept many of these cases before it's too late.
Dr. Kim, I have a thyroid disorder, and one of the things that struck me when I was first diagnosed and then subsequently was discussing my condition with others is how common thyroid disorders seem to be. I mean, I ran into people in my family, among my friends, here at BBN and at church who have thyroid problems. Is there something going on with how we live that contributes to thyroid disorders?
So the answer to that question is it depends. So to start with, hypothyroidism affects about 4.5% to 5% of the U.S. population ages 12 and older. And in most cases are mild, which is why many of these cases are somewhat undiagnosed, because we're talking about almost 5 people out of 100. And the risk of developing hypothyroidism increases with age. And although there's some statistics that talk about how women might get it slightly more than men, and there's certain ethnicities like Caucasians, Asians, that again seem to get it slightly more than other ethnicities. Where we're located in New York City, we've seen it in every single population and in both genders. So it's one of those diseases that doesn't seem to greatly discriminate whether you live healthy or not, whether you have a family history or not, although certain forms of thyroid disease can have some genetic tendencies to pass down from generation to generation. For hyperthyroidism, it's a little different. The overall percentage is between 1% and 2% in the population, although the older you are, the more likely you are to get it, particularly if you're a woman and particularly if you smoke. Some estimates have it up to 4% to 5% in older populations, depending on certain studies.
Well, how are thyroid disorders like hypothyroidism and hyperthyroidism treated?
Well, fortunately, simple blood tests that measure your levels of thyroid hormone and the chemical that stimulates thyroid hormone production, known as TSH, these can be ordered by your healthcare professional. And depending on those tests, more tests may be ordered. And depending on whether you're hypo or hyperthyroid and why you are either hypo or hyperthyroid, the treatment would be tailored to the cause. In the case of hypothyroidism, replacement thyroid hormone is the usual first choice, but in hyperthyroidism, options to control the production of thyroid hormone can include certain medications, but perhaps you might need further treatments like radioactive iodine, or in certain cases, removal of part or all of the thyroid glands surgically. And your physician or healthcare professional should be able to guide that process, and sometimes, in difficult cases, an endocrinologist who specializes in the body's hormonal processes may be recommended as well to you for further evaluation.
We're talking with Dr. David Kim. He is the Chief Executive Officer of Beacon Christian Community Health Center in New York City, and we're discussing common thyroid disorders that affect many Americans, some of whom that don't even know that they have a thyroid problem. Dr. Kim, I don't have access to results from clinical testing, but as I talk with some patients, I have been told that while treatment keeps their thyroid hormone levels in tolerance, the treatment doesn't necessarily alleviate some of the symptoms that are being experienced. Is that uncommon?
No, it surprisingly really isn't. Our experience at our faith-based health center in Staten Island has shown that patients, although they might have quote-unquote normal numbers, can still experience sluggishness, fatigue, anxiety, and even depression. It's important to note that health isn't just about prescribing pills to solve a physical problem. We've repeatedly found at Beacon that health issues in our patients tend to have mental, emotional, relational, and even spiritual components. And dealing with disease in general is a very stressful experience, and especially in a chronic condition like hypothyroidism, the lingering physical, mental, emotional, and spiritual effects can prevent people from truly making progress to getting better. And that's the case for hyperthyroidism as well. So in these cases, we use a comprehensive approach that addresses each of these aspects of a person's health, the physical, mental, emotional, relational, and spiritual, to try to figure out why a patient isn't fully getting better. And we've even gone so far as to pray with certain patients who allow us to pray for them. And we've seen incredible improvement just from resetting, if you will, their overall approach to their disease. And there may also be other disease conditions that need to be looked at in the same patient with thyroid disease. Again, you've got a number of diseases like thyroid, diabetes, and others that can mimic each other or mask themselves as normal body issues. So it's really important to be alert and attentive to all these various factors and have healthcare professionals who can, walk along with you on those.
According to the U.S. Food and Drug Administration, there have been 5 recalls of various thyroid medications with levothyroxine and liothyronine from 3 different pharmaceutical companies since last year. Dr. Kim, do you know what the problems were that led to these medicines being recalled?
Without going into too many details, because that would take some time, in most cases, in general, the recalls were of natural thyroid medication. These are medications using thyroid hormones obtained from pig or cow sources and repackaged in its consumable form by humans. These formulations coming from animal thyroid glands instead of being synthetically produced in a uniform fashion in a laboratory historically have been notorious, to be honest, for being difficult to obtain universal similarities in potency from dose batch to dose batch. So in at least a few cases, it caused the product to be pulled by the FDA in this case. Not so much because it was unsafe, but because unlike synthetically made thyroid hormone formulations, there was no way to guarantee the uniformity of the potency of these doses.
Okay. Well, I hate to do this, Dr. Kim, but we're running out of time for our broadcast today. And obviously, there's still a lot of ground that we have to cover. I wonder if you'd be willing to join us again on a future broadcast, and we'll continue our discussion.
Absolutely. It would be a great honor, and I appreciate the opportunity. Thank you.
Great. We'll look forward to that. Well, we've been talking with Dr. David Kim. He is the Chief Executive Officer of Beacon Christian Community Health Center in Staten Island, New York, and we've been discussing common thyroid disorders that affect many Americans today. We'll continue that discussion on July 3rd, and next week, Mike Dyes will be your host, and he'll explore another topic of interest for the Christian community. This has been Weekend Connection, and we invite you to join us for next week's program here on the Bible Broadcasting Network.
Thank you for listening to this feature, a production of BBN, the Bible Broadcasting Network. BBN provides 24-hour Christian programming, great Christian music, and Bible teaching. Listen to BBN by clicking the link in the description.